La entrevista.
Buenas, soy Stephanie Velarde, estudiante de enfermería, y hoy hablaremos de coronavirus, para lo cual entrevistaremos a la doctora Rachel Uancv y al doctor Paul Brigmer, jefes del Hospital General de Massachusetts, Estados Unidos.
Dr. Rochelle Walensky, Chief of Infectious Diseases at Massachusetts General Hospital. We recognize that these are uncertain times and people are scared.
And I'm Dr. Paul Bittinger. I'm the director of the Center for Disaster Medicine at Mass General Hospital.
¿Qué es el coronavirus y de dónde vino?
The viruses come from bats, probably jumped from bats to another animal before it comes to the human. The viruses generally cause a spectrum of diseases, from very benign diseases like the common cold to more severe diseases like MERS, SARS, and now.
¿Qué puedo hacer para protegerme del coronavirus?
Not have your eyes, your nose, your mouth exposed to the droplets with coronavirus. That means being very aware of touching your face. It means washing your hands thoroughly, more than 20 seconds each time with soap and water, and it means covering your cough if you yourself are ill. Try and stay 6 feet away from other persons and avoid people who appear.
¿Cuál es el alcance de la enfermedad y quién tiene más riesgo de morir por ella?
We know that people can present with actually no symptoms at all, whereas some people can get quite sick with the disease. About 80% of people have mild to moderate disease and do quite well at home. Another 15% will require hospitalization, and an additional 5% will require critical or ICU level care. We know that people tend to do poorer with the disease if they are elderly, over 70, if they have immunocompromising disease, cardiovascular disease, liver disease, or other chronic lung disease.
Tiene el coronavirus una gran similitud con la gripe. ¿Es más contagiosa que ella?
Very similar symptoms as the flu with fever and cough. But when we talk about how the coronavirus is spread, it's very different than the flu for two important reasons. First, the coronavirus is actually about twice as infectious as the flu. Secondly, we actually don't have a vaccine for the coronavirus, where we do for the flu, and 50% of people get vaccinated for the flu every year. Taken together, you have both a more infectious virus and no immunity in the population from vaccination, which is why it's so important that we take the measures we're taking.
¿Cuánto tiempo durará la pandemia y cuándo sabremos que las cosas están bien?
There's no way to know for certain how long this outbreak will last, but we can look to history for some guide. In previous influenza pandemics, including the most severe pandemic in 1918, the waves tend to last about 2 to 3 months, and that's actually about what we saw in China. No one can make a prediction for certain, of course, but we'll know when things are starting to get better when we see the rates of new cases beginning to decline.
Si tengo tos y fiebre, ¿qué tan preocupada debo de estar y qué debo de hacer en este caso?
You're likely to do quite well, and what you should do is self-isolate and make sure you protect your family from getting similar symptoms. However, if you're at high risk, somebody over the age of 70 with immunocompromising diseases, cardiovascular disease, diabetes, chronic lung disease, then I would urge you to reach out to your primary care provider and see if they can arrange a test for you.
Una vez que me recupere del coronavirus, ¿puedo ser contagioso y puedo volver a contraerlo?
Generally keep people in self-isolation after being diagnosed with COVID-19 for around 14 days to ensure that when they come out of isolation, they're not contagious for other people. That's a critical control mechanism for the disease. We don't know actually if you can get COVID-19 again, but we believe not, and there are active studies examining this question.
¿Cómo seguirá el curso del virus?
Like COVID-19 enters a community, all it sees is opportunity because none of us is immune. However, as more and more people are infected, more people become immune, and it gets harder and harder for the virus to be transmitted. In addition, when we practice good social distancing, we take away the opportunity for the virus to be transmitted. And between that social distancing and growing immunity, ultimately this outbreak will collapse under its own weight, and we will.
Si creo que tengo el COVID, ¿debería de ir a un hospital o qué debería de hacer?
Is that more than 80% of cases of COVID have mild illness, and people don't need to see their doctor or come into the hospital. But everyone should watch for their symptoms. If you feel like you're having increasing trouble breathing, if you have pain in your chest, if you feel very dizzy or you're too weak to eat and drink effectively, then call your doctor or come into the emergency department.
Muchas gracias, doctores.
Very much like to thank you for watching. We hope that we've been helpful to you in providing answers to some of the questions we know that you have. We know that in these challenging times, people want answers to help them understand what's happening.
I've spent my entire adult life learning, studying, and being on the front lines of infectious diseases. These are scary times, but we will get through it. There are legions of providers and healthcare workers out there working for you. Thank you.